You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Welcome to another awesome episode of Beyond Wellness Radio. Before we go into today's show, I want to tell you guys about our newsletter. So make sure you go to beyondwellnessradio.com and hit the button that says sign up to the newsletter. By doing this, you will never miss out on an episode. Be the first one to hear it as it's sent out to your inbox each week. If you guys want even more, click on Justin Health link and go straight to Dr. Justin's page and get direct access to the Dr. Justin himself. Having any thyroid issues, he's got your back. Hit the link that says Fix Your Thyroid, and by signing up to the newsletter, you get a free video series that's all step-by-step enabled just by Dr. Justin himself. You can also find my site and my information at the top of the Beyond Wellness Radio site. So if you guys have any questions as well, we have all that there. So we appreciate you guys coming on and listening to the show. So thank you guys for coming on, and let's start it off. How's it going, Dr. Justin?
Paris, it's going great. I'm actually hooked up to my M-Wave right now. It's actually has me red turning to blue, so I'm trying to do the whole podcast today in green, in coherence, in a parasympathetic state, as we'll talk about here in just a bit.
Yeah, it's funny when you mention that. I'm pulling up my M-Wave. As soon as you do that naturally, for some reason, it turns red. It's like it knows it's being looked at. And I'm like, why are you guys looking at me? Same thing happened to me right when I pulled it up. I'm also doing that. So for people out there who's wondering what the M-Wave is, it's a way to track your heart rate variability and to actually train it. So that way you can get in coherence so that way the communication with your heart and your brain are communicating appropriately. So that way you'll be thinking with your brain, but also thinking with your heart and following your true purpose. So if you guys are having any stress problems, this is a great tool. And Dr. Justin does have the hookup, so go to him, and he will make sure that you get a nice deal on it.
And regarding the M-Wave, I just kind of want to make sure people know what's going on. So the whole idea of coherence really is that communication between the heart and the brain, because they found that 70% of the fibers in the heart are actually the same fibers, the same neurological fibers in the brain. So there's a strong connection between the heart and the brain, even just beyond an energetic type of spiritual thing, but more even just a scientific nervous system kind of thing. And also, when we deal with coherence, the whole idea of coherence is basically heart rate variability is a marker of parasympathetic tone, right? The more parasympathetic, the more rest and digest, the more repairing we do, the less breaking down, the less stimulation. And the whole idea is with heart rate variability is the more uneven your heartbeat is, right? Heart rate variability, the heart rate is variable from beat to beat. It's a great sign of overall health. The best, most healthiest people, the Navy SEALs in our military and such, they have great heart rate variability. So it's an excellent marker for health. And it's really just the unevenness, right? The variability between your heartbeats, not having the exact heartbeat at the exact split second, but a slight bit variability from beat to beat.
Yeah, you like Darwin said, it's not just about, I know people take his words out of context and say, survival of the fittest. It's not just about being the fittest, it's about being the most adaptable, right? And that's why having a varied heart rate is important. It keeps your body kind of ready and adaptable, and like you said, in a healing parasympathetic state. I don't think we need too much extra sympathetic stress in our society right now. So trying to do some extra things that are calming and healing to the body will be something that's super important, especially if you're a type A personality. Putting this on and actually getting a reading of feelings, right? Because it's kind of hard. You can't necessarily measure feelings, but this is, I guess, the best tool that I can think of that would do something of that sort. It kind of detects your stress before you even notice that you're stressed out.
Yeah. And one of the things I do to get up in the morning is I activate my sympathetic nervous system. And one of the things I do is I start out, get out of bed, and I do push-ups to failure. I start off then with a foundation training series by Eric Goodman. It's just 2 minutes where I just go and get my extensors working because we're just so much in flexion all day.
Mm-hmm.
And then one of the things I do is I end my shower with about 1 to 2 minutes of a really, really cold shower.
Oh,
and
yeah.
the cold shower basically stimulates my nervous system to adapt. And what it does is it just starts stimulating the sympathetic nervous system. And here's a really cool study I have here. They actually looked at adaptive cold showers as a potential treatment for depression in the journal Medical Hypotheses. And they just found 2 to 3 minute cold shower had a significant analgesic effect and helped alleviate depression. It helped increase beta endorphin levels. It helped increase noradrenaline levels and increase synaptic release of noradrenaline in the brain. And it had an antidepressive effect. So I always start my day with a cold shower, push-ups to failure, and a little bit of foundation work just to get my extensors in because I really want to have good posture and I want to be ready to go. And then I go downstairs. I'll typically then put some coffee on, some butter and MCT coffee in my French press while that's brewing for 4 minutes because I don't want to waste time. I put a podcast on while I do a 4-minute Tabata. And I do that empty stomach because then I'm really tapping into fat, right? Because I'm exercising on an empty stomach, but it's not so long of a duration of exercise where I'm getting catabolic, but it's just enough to start tapping into fat and to revving up my metabolism 10, 20% over the next couple of days to really just increase my body's ability to burn fat and also put on muscle.
Yeah, definitely. And so we're diving into this pretty quick. People are like, I don't even know what the topic is yet. So today we're going to be talking about building a robust nervous system. And Dr. Justin's are already getting into his daily routine. And speaking about your daily routine, what do you have for breakfast today?
Well, today is kind of my standard Friday, I know, but it's kind of the same every Friday. Collagen, 4 raw eggs, butter, MCT coffee, and then I'm hyped up right now on adaptogenic herbs. I feel like adaptogenic herbs should be in everyone's routine. The Russians did tons of research, spent tens of millions of dollars on it. Immune benefits, stress modulating benefits, right? And I think you mentioned the, I want to say Sigmund Freud, not Freud, but
Darwin.
Darwin, yes. Darwin talked about, survival of the fittest, and we really are taking that to adaptation. And these are things that you can put into your body, these adaptogenic herbs. It's right there. It's adaptogenic. It's helping your immune system, your nervous system adapt, your hormones adapt. So again, healthy lifestyle, healthy habits, and then healthy supplements to take your body to the next level of adaptation.
Yeah, especially because taking adaptogenic herbs, that's kind of like even if you didn't know exactly what you're doing, that's a good starting point just because it's not like, it's going to increase it or decrease a certain hormone because it's more of a modulator. It goes in there and says, hey, this is out of balance. You need more of this, and it'll crank, the knob this way. Or it will say, hey, you're overly stressed out. You need less of this, and it kind of just modulates it and puts it back into balance.
Exactly.
So, yeah, definitely. And it's almost like look at the pictures of some of these like plants and take like a deep look, especially like if you look at like something like reishi mushroom, like you can tell by the way it's formed, it seems like a pretty imbalanced kind of plant. It knows what it's doing. Plant power, people.
Absolutely. I totally agree.
So let's talk about, so we started talking about some of the chemical like structures that will help us when we're talking about building a robust nervous system. But we know that talking about our nervous system, it's almost like a highway of information, right? Our nervous system is basically like computer wires. And if we look at, we're currently trying to map out the human genome, and we know that currently there's no computer that is smarter than or has as many connections of neuron than our brain does. Unfortunately, it seems like many of us today have been fed foods that don't allow us to really explore our own brains like we should, and that's kind of our goal, is to allow people to feel their bodies and their brains at a fuller capacity. And with that being said, we know that if there's an accident on the freeway or there's construction, it really slows down communication. And, I can't, if I'm supposed to travel to Dr. Justin's office and he's down the street, if there's a roadblock, I can't deliver the mail to you, right? So what's happening if our bones and our posture and we're out of balance? What's happening there? And let's talk about how to build our nervous system, you said you do the foundational exercises every morning. Let's talk about why it's so important to have a strong posture.
Well, posture is excellent. I mean, it's really important. Anyone that's had a few drinks one night and played the game Jenga, right? Right? Just that Jenga table that's just like sitting up straight, you could put like a bowling ball. You could put like, 3 or 4, maybe even 5 45-pound plates when that thing is just straight up, and that's going to hold. No problem. You start pulling 1 or 2 out, I mean, just breathing on it could knock it over. So what does that mean? That means that structure is really, really important to absorbing force absorption. So this is really cool. So when it comes to structure, simple things we can do, I think Dr. Mercola has talked about this in his new book called Effortless Healing, is having good posture. So having a standing desk is super, super important. Actually, what I'm going to do right now is I have a stand desk. I'm going to go from seated into a standing position right now. So if you hear it get a little mechanical in the background, that's what's happening. But I try to stand about 3/4 of my day. So like 5 to 7 hours I am standing, which is absolutely huge for health. There's a couple of things, right? One, we're activating our extensors. Our extensors tend to be more parasympathetic, while when we go into that fetal position, it tends to be more sympathetic. All right, so before we go into posture, let's break down the nervous system first. So our nervous system basically is just how our body communicates. It communicates via nerves. It also communicates via hormones, and the nerves and the hormones work together. So in our nervous system, we have our peripheral, right? These go to the extremities, right? Hands, feet, and then it even goes to the organs. And then we have our central nervous system. This is like our brain and our spinal cord. So they tend to communicate together. So let's focus on the peripheral. Now we have what's known as our autonomic nervous system. Our autonomic, basically, to substitute autonomic for automatic, meaning you don't really have much control over it. It's automatically happen. Like you're not thinking about breathing, right? You're not thinking about being startled. You're not thinking about, having to go to the bathroom typically. It's just, it happens. It's on automatic. Now, in that autonomic nervous system, we have the sympathetic nervous system, and then we also have the parasympathetic. So I hate these big words because medicine just uses them to confuse people. I just call it fight or flight and rest and digest. All right. Fight or flight is the sympathetic. Fight or flight. It's the part of the nervous system that gets activated when you get startled, right? You're either going to fight, right? You're going to attack, or you're going to run. Right, so it's when you get super stressed, you're in traffic, right? You're gritting your teeth, you're maybe flipping off the guy next to you. It's like that's the fight or flight. And then the parasympathetic is when you're like deep belly breathing. Maybe you're finishing that yoga class and you're in shavasana or corpse pose, or you're sitting there in a meditation, or you're next to your wife or partner and you're just like feeling just really great contentment and great connection. That's the parasympathetic nervous system. Parasympathetic is important.
Put me back to sleep, bringing back yoga things. I'm just like, the end of yoga. I'm falling asleep. Yeah.
That's my favorite pose, corpse pose. I am the best at that pose.
Exactly.
So parasympathetic is bringing everything inward, right? Parasympathetic tone takes blood, brings it inward to the organs, to nourish, to bring nutrition inward. It also helps with digestion, right? Parasympathetic is rest and digest. Blood's going inward, repairing. We're increasing DHEA and testosterone and progesterone. We're healing. Where sympathetic is shuttling stress hormone output, right? The sympathetic nervous system whips the adrenals into action to make adrenaline or epinephrine, right? Same thing. That epinephrine then stimulates cortisol. And the job of it is to mobilize sugar so the extremities and the arms can run and fight and flee, where the parasympathetic is driving inward and trying to help repair. So linking that back to posture, sympathetic tone is always going into flexion, right? Tight hip flexors, going into that fetal position, flexing over. That's the sympathetic. So trying to go outward by getting your body into extension, opening your chest up, pulling your head back, pulling your shoulder blades back, keeping your external auditory meatus, right? Big fancy word again, your ear hole, ear hole over the middle part of your shoulder, over your hip, over your ankles and your knees. So just kind of having a really good kind of plumb line type of alignment, that's going to be really important. And kind of tying the analogy back to Jenga, when that Jenga is perfectly straight, you can put like 200 pounds on that Jenga piece. It's not going to go anywhere. You pull one or two out, it's shifting a little bit forward. Just breathing on it will knock it over. So I'm going to take a deep breath there, Barris. Go ahead and
definitely.
comment.
I got a new analogy, and I think it's funny because we always talk about like how we make up analogies, but isn't that the point to kind of trick? Because knowledge is really power, and when it's in a different language, sometimes it's like hieroglyphics, right? Like what is the parasympathetic nervous system? It doesn't make sense to me. So by connecting it with something we know that makes sense to people, it starts to fire off those new neurons, and you start to build new knowledge, and it connects and it sticks. So since we're talking about, developing a robust nervous system, I thought, hey, why not throw an analogy so that way we can, have some neurogenesis and create some new connections today. And I thought of a good one, a way to kind of think of how the nerves and hormones work, because they're both sending information and basically things to do. You can think of the nerve cells and the connections almost like email or phone call. Even though Dr. Justin's in Texas, I can say, hey, I need this or this, or hey, we need to get this done, or blah, blah, blah. He could do the same thing. When you send me an email and is there instantly, right? I got the connection at the speed of light or the speed of whatever the speed it travels. And then hormones are more like, the postal service, where like, for example, I recently got some Zen frames from Dr. Justin and, made a phone call, sent an email. Hey, could you connect me and give me a pair of these? I'll go ahead and I'll send a payment to you. And then, put it on air flight and got it, 2 days later. So the nerves fire instantly, whereas the hormones are a little bit more gradual. But when they do hit, they do have a strong effect.
Exactly. I mean, there are certain hormones that are fast, right? The sympathetic nervous system will stimulate adrenaline, norepinephrine in like split seconds. But cortisol comes to the show minutes later, right? Cortisol is not a fast one, but your adrenaline is super fast, right? And then we have like our brain, right? Our brain has some effect on the parasympathetic. We have these things called cranial nerves, right? The big ones that are parasympathetic are 3, 7, 9, and 10. Don't really have to worry about it. But again, eyes, salivation, right? So these really important, right? Taking in good sights, seeing good things, chewing, breathing in through the nose, nasal stimulation. These are all things that are activating the parasympathetic nervous system. That's why when you eat, chew your food 30 times or so. Don't be anal about it. Chew your food to about like an oatmeal-like consistency. When you walk in nature, look far away. That stimulation through the eyes is very important. Lots of studies with long-distance viewing while in nature will help alleviate depression. Okay?
Yeah.
Breathing in through the nose will stimulate parasympathetic fibers and put you more into a coherence parasympathetic state. So these are simple things you can do with the brain. Now, on top of that, we have this really cool nerve called the vagus nerve. It's cranial nerve 10. And the vagus nerve does all kinds of stuff. It affects the spleen and affects the heart, and it affects the stomach and the pancreas and the intestines. And this is the nerve that gets stimulated when the parasympathetic is really activated. It affects digestion. It affects all of your organs. So that gets shut down when we get into a stressed out state. So just think, when you're getting stressed out, you're cutting off your trip to Vegas, so to speak, right? You're cutting off that vagus nerve. So if you want to go to Vegas, you really want to be working on doing things to keep your body in that parasympathetic state, breathing, the M wave, right? 5-second breaths in through the nose, chewing your food really well. These are all great things that you can do to help get yourself into a parasympathetic state. And then also, avoid eating inflammatory food. You're going to keep yourself totally locked in a stressed out state if you're eating food that's inflaming you day in and day out.
Yeah. Yeah. And like you said, whereas like the nervous system is working a little bit made quicker, and you do have some hormones that work quicker, 2-day express mail, right? When you have like the foods working on a chemical, like it kind of has a prolonged delay effect. Like you eat a food, it takes a couple minutes and then it starts kicking in. Like if you eat a jalapeno, like you don't instantly just sweat, but give it a minute or two and it starts to compound and you start to sweat and you start to notice those effects. But they do have like a delayed response too as you digest it. Like it will stay in your system for a couple of days depending on whatever the substance is. So if you're continuously, even if it's a every other day thing where you don't eat a burger every day, but you go to McDonald's every other day, well, it's going to have a negative effect on your health in your body, because you're still, it's still lingering. So by the time it's finally, those inflammatory response finally start to end and like, okay, we can relax, you guys. It's like, oh, here he's eating another burger.
Yep, exactly. Exactly. So there are things that you can do to get to tap into your nervous system. So I love chiropractic medicine, very passionate about it. And one of the things that I use as a window into the nervous system is applied kinesiology. So applied kinesiology is really cool because when we talk about the nervous system, right, we talked about the automatic nervous system, right, the autonomic. Well, on the flip side of that is the somatic. Okay.
Yeah.
And the somatic is just another word for the muscle nervous system. So it'd be so much more convenient if they just named it the automatic and the muscle. But I already said, right? They keep you confused so you don't understand your body, right? So we can use our muscles as a muscle testing, applied kinesiology muscle testing as a window to how the nervous system is functioning. So I can come in there and I can test someone's psoas muscle and get a window into L4, L5, S1 muscles. I can test their shoulder, their deltoid, and get a window into C5. I can test their tricep and get a window into C7, vice versa. So I can, put force into someone's muscle, and the goal isn't to see how strong they are like you're benching 300 pounds. I've had gold medalist Olympic athletes that I could literally press down the rectus femoris muscle with one finger. Now, if you would have put that guy in the gym, he'd be ridiculously strong and fast, but it's not about that. It's about applying a set bit of force and seeing how fast they can adapt to that force. And the slower they adapt, that means the higher risk of injury and also the less ability they're going to have, the decreased ability they're going to have to generate force as well.
Yeah, definitely. And then so the terms for that, again, you said applied kinesiology, and it's also muscle testing. I know some people get kind of weirded out, oh, how can you muscle test? But we mentioned that our muscles are basically just kind of conductors of electricity, right? Like we have, you yourself have, and myself as well, have different machines that stimulate these muscles just simply with electricity, and we can show, hey, yeah, they respond to electricity. We are bioelectrical chemical beings.
Yeah, exactly. And when we're doing muscle testing, this is on a direct link. It's a direct muscle test, meaning we're looking at the somatic nervous system, right? Just Google somatic nervous system. What you'll find is it's the branch of the nervous system, the peripheral nervous system, meaning outside of the central nervous system, that controls voluntary movements, okay? We have afferent, right? Afferent nerves go from the muscle into the spine, and then we have efferent nerves that go from the spine out to the muscle. So if you move your muscle, right, you're using efferent nerves to then stimulate the movement. And if someone touches your leg, the interpretation of feeling that back in your brain, that's going to be more afferent. Afferent's going up. Efferent is exiting. E for exiting, A for entering. So that's kind of a good thing. So we have a direct window into how your nerves are functioning with applied kinesiology. Now, this is different. Like if you have someone that muscle tests for supplements, that's getting more into an energetic type of realm where you're putting maybe a supplement on your chest. That's getting more energetic because you have to have energy from the bottle go into your, your nervous system. And there is some validity for that, for sure, but it's not nearly as scientific as applied kinesiology for the body because we're looking at the somatic nervous system myotomes directly. There's a direct indication for that. Now, if you want to test supplementation, an even more direct way to do it
isn't it usually under the tongue?
Yeah,
or you hold it for a little bit.
Yeah, put it right in the mouth because then it's hitting your lingual nerves. Now that's a direct nervous system test because it's going into your nerves. Your nerves are then going from the that's the olfactory and I think the cranial nerve number 5 is taking that up to the brain and it is telling it, hey, what's going on. The brain's sensing it and reading it for nutrients or for toxins or whatever, and you'll either get a strong or weak test. So that's more of a direct muscle test, nervous system wise when it comes to nutrition. So if we were talking energetic stuff, that's not what we're talking here. That's what I call more indirect. We're talking about direct muscle testing. So when I work with my professional athletes or college athletes or people that are just trying to get better from an injury, we're going and we're testing all their muscles because that gives us a window into their nervous system. And by getting a window, if we see those muscles aren't working, we know the communication to those muscles is impaired. And when we know it's impaired, there's a couple of things we can do. We can apply a specific adjustment to get movement into that joint, which will help the communication, right? It'll get the nerves communicating, so it'll help that afferent. It'll help the communication going in.
And let me cut you off real quick because I think you brought up a really, really good point that I want to make sure that doesn't just slide past people real quick. And this is going to sound irrelevant right now, but it's going to make sense. Okay, so our gut bacteria is a community of cells and different bioorganisms that are basically kind of change how our mood is in our body, and they communicate with each other. The same way when we eat plants, they send a direct message to us, or we eat animals, and it could be a good message or bad message. It can benefit us or negatively affect us. But the same way, if someone's diabetic, their foot is numb, they're having poor communication. At the end of the day, we have to remember that all of these processes are just a form of our bodies. It's kind of having to have, you have to have some kind of holistic view to fully understand this or even believe what I'm saying. But it's just a form of our body more as an organization, as an organism, and not just a one static thing, and that everything is just trying to get into homeostasis and basically communicate with each other. So if you have impaired communication on any level, and you're the same way, if you get a misinterpretation with, your wife or your girlfriend or something like that, you might have an argument and be like, oh, well, my phone didn't receive your call and we had a missed call, and bam, there's issues. The same way with your body. So I just wanted to make sure that you pointed out, like, you had a gem in there, and you just talked about like impaired communication. That's, I think, super big. So go ahead. Sorry.
Awesome. So where chiropractic is phenomenal is that the body, especially the spine and the joints, they communicate via movement, right? So if that afferent communication isn't coming in, right? It's that old adage in programming, crap information in means crap information out.
Yeah.
So if we aren't getting communication because things aren't moving properly, or because the muscle is shut down because of an adhesion or a trigger point or scar tissue, we're putting crappy information into the system, which is almost going to guarantee crappy information out. So as a functional medicine doctor, I apply kinesiology as a window into the nervous system. And then we can test, hey, is it by having them touch certain places on the spine, on the joints, or on the muscle tissue, we can see how it gets stronger, right? So the body's amazing because if we bring awareness to something, we can actually get a window into how the body functions. So if I touch my back, let's say my psoas muscle is weak. So if I put my leg out at a 45-degree angle and I press down, that shows weak, I could have my patient then touch their lower back where those nerves are. And if that strengthens, that's the body or the nervous system telling me this area wants more input. It wants more communication, and we can provide that by adjusting that joint. Or if I touch the muscle, if touching the muscle strengthens it, what my nervous system is saying, there's an adhesion or a trigger point. There's something in the muscle that's affecting the communication. And we can do a soft tissue technique like ART or myofascial release, or a Graston technique, or a muscle spindle technique, and we can reestablish communication to those feedback loops. So this is like direct science. And if every doctor knew about this, we could be preventing injury. We can have our patients performing so much better.
Yeah, and that's our goal, is to slowly but surely get this out to the masses, because just like we mentioned earlier, how it's just like a highway of communication, and you don't want your muscles to be like LA traffic. You want a steady flow, you know what I mean? And it's the same thing. And then so we're talking about the muscles in the spinal system and the importance. I noticed a big thing with people is like low back problems, and even myself, at a younger age, I'd gotten into a car accident and started like cracking my neck way too much, and then so I started developing bad, and then also school. Sitting down most of the day doesn't help with your posture, but I see a lot of people in the gym wearing like weight belts, so that way they can squat a lot of weight and kind of protect their spine. But don't we naturally have, if it's strong and in a correct position, natural weight belts like our transverse abdominis? Isn't that supposed to be our stability right there?
Yeah, exactly. When I was a personal trainer about a decade ago, we used to see people with weight belts, and we would just call them, we didn't even call them weight belts, we called them TVA inhibitors. We just called them transverse abdominis inhibitors. Essentially, your transverse abdominis is like the natural corset that kind of goes around your tummy. And basically, for your transverse abdominis to work, you have to draw the belly button in. And I don't want to get too technical, but that would actually decompress the spine. It would actually pull the spine apart, because certain muscles and their connection on the spine, it would decompress the spine and actually take weight off the spine and provide more stability to the spine. Now, when you put a weight belt on, the mechanism becomes totally reversed, meaning to activate the weight belt, you have to push your belly button into the weight belt to make it stronger. So it becomes the exact opposite of what you would do in normal life. So if you go and you start lifting weights with a weight belt on, you start telling your brain to push out into the weight belt to get support. So then when you're not wearing a weight belt, guess what happens? You train your nervous system to push out, which is actually going to compress your spine and make your spine more unstable.
Yeah, it's not a good idea to practice with that. I always say, like, the only time I see people that like know how to train like really use that, and you still shouldn't even need it, is like when they're doing like their max, and it's like, oh, okay, for extra safety. But like I see some people do it just like, oh, I'm gonna hit the squats, where's the belt? It's like, that's not just an everyday thing to use. I think that's supposed to be used when you're using like a Olympic type, or just whatever's like your max and you need extra safety. But it's not supposed to be, oh, I'm doing squats today, I need my weight belt.
Yeah, and then even that too, it's great if that's what you're really into, but man, if you can't use your muscles, as a kinetic system, and you have to have something in there to stabilize you, well,
you probably don't need to be lifting that much weight in the first place.
Yeah, because the problem is that muscle, the performance enhancement you're getting from lifting that weight will never ever translate to the real world. So it's like, it's cool because in this little bubble called the gym, and that little one rep you do, that's the only time you'll really have that strength, and that strength will never ever carry over into the real world. So you're much better off, in my opinion, training in a way where you can carry as much from the gym into the real world as possible.
Yeah, because that's like making your legs super strong, and then you're on the field or on the court, and your leg is strong, and as soon as it gets up to the abs, it just like the power just starts to diminish.
Yeah.
the circuit goes out, and it just zoom, and then your shot's still weak, or your whatever you're going to do in your upper body, it doesn't connect. Right.
Yeah, I mean, you see people in the gym doing their leg presses like, 10 45-pound plates on each thing, and it's like, great. Do you see that like machine? It's like a 200 or 300-pound machine. There's a lot of stability in that machine. Are you going to
Mm-hmm.
strap that machine to you when you go out in your backyard and play catch with your kid? No. So that strength exists only in a vacuum, called
Mm-hmm.
the gym on the leg press machine. Nowhere else will that strength ever, correlate. Now,
Mm-hmm.
if you're a bodybuilder where your job is you want to just, make muscles look really big, it can be good for hypertrophy, for getting those muscles to grow.
Mm-hmm.
But again, you can have nice big muscles and also have functional muscles too. So we don't want, my goal is with my patients is we don't want big, stupid muscles. We want healthy, lean, or big, smart muscles, depending on what you want, depending on your goal.
Exactly. And and even with that too, because I know some people like they want to be big and functionally fit. It's almost like a type of tool that, okay, if you do use it or if you have an extra weak point, that's almost like a supplement, right? Like it's okay to isolate, but if you're going to isolate, make sure you integrate after.
Isolate
Like,
and integrate. Yeah, that's totally
yeah,
fine. Like, hey, you want to do some bicep curls? That's fine, but maybe you should also
do
do
some
some things.
pull-ups, right?
Do some pull-ups as well. Do some lat pull-downs as well. Maybe do some kettlebell swings or, some push-ups or, single arm cable presses. There's some things you can do that will still help you integrate as well.
Yeah, exactly.
So I want to also talk about some of my problems with most chiropractors too.
Yes, let's do that. Just because I do know there's oftentimes people they want to go seek a chiropractic help, but they've also heard, you know, um, not the best things about it, and that's where you get into like the gray area, and it's like you kind of have this, they're either great or not. So let's talk about what to look out for.
Okay. So there's a lot of chiropractors out there that, are just going to throw people into the same adjustment each time, right? Kind of like a rack 'em,
Hmm.
crack 'em, or in the industry they call it a flying seven, where you're
Hmm.
doing the same 7 adjustments each time. Meaning you do a hip adjustment on one side, 2 sides, you do 2 thoracic adjustments, you do maybe a lumbar adjustment, and then 2 cervical. So you get about 7 adjustments in, and they call it a flying 7 because you just fly through it. Not
Hmm.
a fan of that because there's absolutely no specificity.
Hmm.
And you'll get some of these guys that will be like, well, I have great stories. And it's like, yeah, I mean, even a broken clock's right, twice a day.
Right.
You're going to probably get someone in there and you're going to adjust that hip, and that's going to maybe get that hip flexor turned back on. But it's much better, in my opinion, with the patient to be specific, to show them, educate them what's off, turn it back on. And again, there are some patients I see where it's more of a soft tissue issue, meaning there's
Hmm.
issues in the tissues. The tissues are creating inflammation and shutting back that afferent, right? That communication from the muscle to the brain. So it may be a soft tissue thing that will then allow those muscles to turn back on. And remember, the muscles move the spine and move the joints. So if it's the muscle is the primary issue, there's no adjustment that will ever get that muscle back on if it's a
Exactly.
primary muscle issue.
Hmm.
Okay, so that's my big concern. And then a lot of chiropractors have the mindset of they're getting a bone off a nerve, and I don't like that mindset. I think that's a very antiquated, about 100 years
Hmm.
old kind of philosophy. We
Yeah.
do know there are some chiropractors that we really are getting, nerves unpinched, especially when we see
Hmm.
disc issues or disc protrusion or disc bulging. There is definitely the nerve being pinched, and you know that because you're feeling a shooting sensation. You're feeling tingling and numbness in the feet because of a nerve issue, or
Yeah.
because of stenosis in the spine or in the intervertebral foramen. That's where the
Hmm.
nerve leaves the spine. We can see that, and there's a lot of signals that we'll see. We'll see super weak muscles, like can't hold them up. We'll see tingling. We'll see issues like that. In my opinion, based on the research, a lot of the nerve communication issues that are being changed are due to lack of movement, are due to stuckness in the spine. And that's where I think
Hmm.
chiropractors are really helping in the nervous system, is because they are getting joints that aren't moving properly to move. And if they're
Hmm.
using applied kinesiology, they can also get the muscles that aren't working to be back on as well. And
Hmm.
not even just that, eating gluten. I've had patients eat gluten and we test their muscles that were strong, and that can get the muscles super weak. So if you're eating gluten and then you have your muscles turned off and then you try exercising and then you injure your back and then you injure your disc, now that disc could be pinching the nerve, right?
Mm-hmm.
So you could have a back problem that could have stemmed originally from a gluten problem because it's shutting down the muscles, which were shutting down the ability to shock absorb the force in the back, which then caused the disc to then hit a nerve. So it's very possible that's happening as well. So not a fan of the philosophy of bone on nerve, not a fan of the flying 7. I think it's better to find a good chiropractor that's going to use, I like imbalance technique or neuro-target technique. Mm-hmm. This is a form of applied kinesiology that looks at the nerves by using muscle testing. A lot of applied kinesiologists, they have their own type of muscle testing. Those are great ways because you can be really specific and you can see exactly what parts of the nervous system aren't working, and then you can apply the right therapy to get it better. Mm-hmm. And that could be soft tissue. It could be an adjustment. It could even be a cranial issue. Someone that's bumped their head, if that cranial bone in the skull is not moving, it could shut off something in the lower back. So we'll get people that have gotten a car accident, gotten whiplash, and bumped their head. We'll see maybe their glabella. They have a glabella cranial issue. We'll adjust the glabella or we'll adjust the sphenoid, and it's like, wow, like everything just starts working again, because if the skull bone's not working, well, the skull, inside the skull is the brain, and the brain affects everything. We can have problems for sure.
All kinds of problems, yes, definitely. So, and like you said, so it's not just about, just cracking people's bones or their joints, but at the same time, you don't want to just send people through the same mechanism. We know that everybody has different issues. Everybody's a unique snowflake in their own right. Yeah. And to make sure that you treat their problem because then you're getting direct feedback rather than just saying like, well, I'm just going to, you're basically just gambling at that point when you're saying, well, I'm going to have 10 patients and we're all going to do this, and 2 of them are going to feel amazing, and then all the rest are going to feel, okay, I feel a little bit better, but, you want to use a finer tool, be more accurate with your diagnoses.
And there's a branch of chiropractic medicine called chiropractic neurology or functional neurology, and that's cool as well because we can look at, eye pupil dilation. We can look at whether your hands turned in or out. We can look at body sway. We can look at oxygenation on a pulse ox from one side to the other. We can look at various reflexes. We can look at the eye, how the eye's tracking, right? We can look at many different things regarding like pupil dilation, like I said, how the uvula deviates, how the tongue moves from one side to the other. There's lots of different things we can do to get a window into the nervous system. And in functional neurology, we may do adjustments on one side of the body over the other to stimulate the cortex on one side, or to stimulate the cerebellum on another side, or we may give like eye exercises on one side to then support the cortex on the other, or we may have you, count backwards and swing your other arm to stimulate your cerebellum, right? There's lots of cool things you can do in conjunction with applied kinesiology that really support and nourish your nervous system.
Yeah, definitely. And then when we look at like functional neurology and also things like even bioenergetics and stuff like that. And that was, I think, William Reich, who studied under Sigmund Freud, wrote about bioenergetics. So did Alexander Lowen. But it's funny, too, because sometimes you bring up these topics and it's a little bit more Eastern and esoteric for some people to accept and to think about. But it's real easy when you just show a picture of someone slumped over and say, hey, what do you think their emotional state is? Well, probably down or depressed. And you see someone with their hands up and with a smile, they're, it's probably victory or confidence, right? And we know that, well, the same way, your body affects your mind affects your body. In the same way you mentioned, you can actually identify and see your perception through looking at your pupils or your tongue or your body and seeing how fast your body reacts, your reflexes, how is your body taking in the information from the outside world and actually using it appropriately? Are you, because like for an example, if you're blind, your pupils won't change at all because they're not receiving any information.
Exactly.
Which, and so if you can notice, well, you're not blind, but your pupils, they don't dilate like they could be. Well, we know that there's a problem with the nervous system. It's not receiving the outside information. And as an athlete, or even an everyday person, you want to be able to take in information and be able to apply it appropriately. So that way your inner world, your own health, right, can appropriately adapt to your environment. So,
Exactly.
Yeah, definitely.
Exactly. I like that.
Mm-hmm.
And just to give everyone just kind of a recap of everything that we kind of gone over so far, we have the peripheral nervous system, right? That's the outside of the spine. And we have the autonomic,
Mm-hmm.
and the somatic, or the muscles. And then we talked about the sympathetic, the fight or flight, and then the rest and digest, and how stimulating the rest or digest is really good. Again, I like stimulating the sympathetics in the morning through a good cold shower and some high quality butter and MCT coffee. That's a really great way, with also having some good nutrients in my breakfast as well.
Mm-hmm.
And there's one other thing I wanted to address that I don't think we touched upon, and that's a whole nother branch of the nervous system called the enteric nervous system.
Mm-hmm.
And the enteric nervous system is basically nervous system in your gut. It's the microbiome in your gut. And there's just as many nerves in our gut than there is in our whole spinal cord. So this is like really profound, because having good bacteria balance has a huge effect on our nervous system. And if we're eating bad foods, that signal, that inflammation and the skewing of our gut bacteria, basically stress in our gut can create stress in our brain. And that's because inflammation is bidirectional. Okay, big word. Yeah. I get it. That means there's a two-lane highway of communication. We eat food and crap that makes our tummy stressed. That stress then goes on the highway back out and affects our brain, which can then throw us into a fight or flight or sympathetic state. So remember, every bite of food that you're taking in is either going to be driving you into an anti-inflammatory state or driving you into an inflammatory state. And the more inflamed we are, the more we fire up the parasympathetics. The more the parasympathetics are fired up, the faster we break down.
Sympathetic.
The more we fire those sympathetics, the faster we break down, and the more we shut down those muscles. So then we're going to be prone to being slower and also getting injured.
Mm-hmm. Yeah, definitely. See those darn big words, right, Dr. Justin?
Yeah, I mean,
yes.
You got to break it down and figure out little nicknames or little like abbreviations or little mnemonic device to make it make sense. If not, you're just memorizing silly things. It's like in school we'd memorize the loop of Henle, which is like the cerebral vascular loop in the brain, or the columns of Morgagni, which are like the hemorrhoid veins in the rectum, and like these silly names. But
it's like gotta make up that. Yeah, see, because even professionals slip up and get it wrong sometimes, and it's like, so yeah, it's definitely, like we said, it's all about communication, right? It's all about communication.
Yeah, and it doesn't matter if you understand the name. It's understand the concept. If you understand the concept, you win. Knowing the name means crap, but if you know the concept and you get that, then you're on the right track. And again, the enteric nervous system, just to be on the right track here, that's going to be part of that parasympathetic nervous system. That's going to really be part of it. So the more we have that good enteric nervous system feedback, that's going to drive more parasympathetic. And I always tell patients, the bacteria in your gut, good bacteria eats poop and poops nutrition. Bad bacteria eats nutrition and poops poop.
Yeah.
In other words, good bacteria provide nutrition to your body. Bad bacteria provide toxin to your body.
Mm-hmm. You almost have to think about it like if your body's a garden. You throw worms in there because it helps, and you don't necessarily feed the flowers, you feed the soil, right? And you feed the worms, and the worms will feed the flowers. And if you want to be a beautiful flower, make sure you're feeding the right worms in your stomach. Well, let's say microbiome, because if you tell someone they got worms in their stomach, they might not feel good about that.
Exactly. Exactly,
Mhm.
Barris. Well, do you have any more comments at all?
No, we went through a lot of stuff today, and I think it was really well-rounded when talking about the scientific aspect of it, but also, bringing back some of the traditional medicine and showing how we are able to scientifically measure it. So again, for any people or anybody out there that wants more information on this topic, make sure you send us a line. Go to beyondwellness.com/questions, and you can also ask your questions there.
Good job, Barris.
Thank you. And then also, we would greatly appreciate it if you guys leave us a review. Leaving us a review on iTunes definitely helps us get this message out there. Like we mentioned, it's all about communication, and we start to show that it's a good show, and you guys leave your comments there. We greatly appreciate it, as it helps us grow and help us send this message out to other people, because there's a lot of people in this world that need help. I mean, heck, me and Dr. Justin are constantly on a daily basis just looking for more stuff, even for ourselves. So we're hoping that this information gets trickled down for everybody.
I agree, Barris. And I just think if anyone listened to this and is a little bit overwhelmed, listen to it twice. But I'm going to just break down the key take-home kind of action items right now, the key ones.
Definitely.
Do cold showers in the morning.
Mm-hmm.
Do a 2 to 3 minute cold shower. Take your warm shower, like soap up, do all that stuff, get all feeling good. Soap doesn't really sud too well when it's cold. But then end your shower with like a 2 to 3 minute cold shower. Get up, have a good breakfast, good proteins. Work on breathing, that good 3 to 5 second breath in through the nose, out through the mouth. That's going to activate the parasympathetic fibers. Do your best to really have an attitude of gratitude, right? We want to make sure you're thinking right. That's going to put you into parasympathetic state. Chew your food well. The chewing will really stimulate the incretins, and that will stimulate parasympathetic response. Do your best to eat food that's going to be anti-inflammatory. And go find a good applied kinesiologist, imbalance chiropractor that can test your nervous system from a structural perspective and help keep you in balance so you can perform well and prevent injuries. That's a good take home right there. And feed your gut bacteria. Good fermented foods, healthy probiotics, avoid all the crappy stuff. And if you have any tummy issues, get checked for an infection, because infections will keep stressing that enteric nervous system.
Mm-hmm. Definitely. Yeah. Feed your gut brain. So that way you can trust your gut, right?
That's it, Barris.
Thank you so much, Dr. Justin, for providing such awesome information. Again, for everybody else, make sure you go to beyondwellnessradio.com. Thank you guys for tuning in. You guys have an awesome day.
Thanks, Barris. You too.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.